That's one of the reasons why with COPD patients and patients who have chronic diseases, they are, it's recommended for them to go ahead and get a pneumonia shot. So hopefully they won't. Yes,
Do you think that really works?
I do.
You do?
Yes, I'm a believer in vaccinations.
Well, I just had a question. I'm sorry.
Last year, my wife had pneumonia 3 times in 3 months. Ever since she's had that shot, she hasn't had pneumonia once this year.
That's good.
So it works.
One of the nurses I work with at the nursing home, she said she got it, and she told me it was like a couple $100, and I didn't know if it was worth it or not.
Well, now I take that back. If you don't have, like patients who are older and patients with COPD, and like I said, a chronic kidney failure or something like that, yes. People our age, not necessarily.
We can call.
I mean, because our body is pretty good at fighting off infection. So I should take that back and say it is the older group that benefits most, or people with chronic disease that benefit most from a pneumococcal vaccination, which is the most common type of pneumonia, but not the only type of pneumonia, just like the flu vaccine. It's only good for one strain, and there's a ton of different strains out there. They just try to find the one that may be the most pathogenic that year.
It just messed up this year.
Huh?
It just ended up messing up this year.
Yeah.
Well, how long, like, how often would you get, like, you get the flu shot every year? Would you get the pneumonia shot, like, every year?
5 years on
Every
the,
5
unless
years.
something's changed, it's good for 5 years.
Oh, that's good.
And typically insurance pays for it. I mean, so if you are an elderly person and are getting the pneumococcal vaccine, then your insurance will take care of it. Because they don't want you getting pneumonia and getting in the hospital, and then the insurance company gets charged $2 million because you were in the hospital for a week.
Right.
Okay, so pneumonia. Can y'all figure out that this is an acinus right here? It's an alveolar cluster, okay? So inside of this, we've got fluid, we've got debris from the causative agent, we've got macrophages, we've got different leukocytes, white blood cells that have come into the area. So inside the alveoli, there's a bunch of stuff that's normally not there, an increased amount of red blood cells that have actually moved from the pulmonary capillaries into the interstitial space potentially and into the alveoli. Different from pulmonary edema, this is all coming from a microorganism, okay? So this is a bacterial pneumonia. This is just a microscopic slide, and I don't know a whole lot to tell you about it. It's in the book, and so if somebody's looking under the microscope, this membrane right here, that red area, that still looks intact, and that's something that the pathologist can look a little closer at. So what happens? What's the pathology with pneumonia? Inflammation of the alveoli. Alveolar consolidation. How is that fluid going to show up on the chest x-ray? White. Opaque. Atelectasis, but especially with aspiration pneumonia, there tends to be more alveolar collapse with that type of entry into the alveoli. Now this slide is strictly FYI, you can write it up there, but I think and this is not a current slide, this is a few years ago. And I tried to find something current, but I couldn't find anything that was, kind of any more drastic than this. Pneumonia and influenza combined are the 8th leading cause of death among Americans and the 6th leading cause of death over the age of 65. And I won't be surprised in 5 years if that number doesn't change. I'm not for sure, but typically when these statistics are done, they're done on a 5-year basis, so everything's 5 years out. Chronic obstructive pulmonary disease, asthma, smoking, heart disease, diabetes, weakened immune systems, all of these things set the person up for death. So if someone gets a pneumonia, I have diabetes, but I'm young enough, I don't have any adverse effects from my diabetes yet, except for vision. So if I was to get pneumonia, I think I'd fare pretty well if I got to the hospital in time, if I didn't have an aggressive type of organism. But someone with COPD like my dad, if he was to get pneumonia, then his, chances for survival are just dropping from whatever pneumonia it is. So when you have a comorbidity, then, and that means another disease along with this one, then that is worse on the body. So it's estimated that approximately 50,000 Americans die of pneumonia each year. That's a lot. That's just in the United States. Okay? So what causes pneumonia? Bacteria, viruses, fungi, protozoa, parasites, and aspiration. So antibiotics will not get rid of every pneumonia. Antibiotics will only get rid of the pneumonia caused by a bacteria. And that's if you get them fast enough. And it's not a resistant bacterial strand. Now there can be chemical pneumonias with the inhalation of gases that cause this inflammation and alveolar fluid. Now, has anyone heard of the term double pneumonia? This is typically used by the layperson when someone has pneumonia in both lungs. I got a double pneumonia. It's bad. Now it's kind of hard to see, but this area right here, and it's easier to see over here, is where the consolidation is at. This is, I would say, a milder case. Now in the chart, you may read that the patient has lobar pneumonia, they have interstitial pneumonia. This is what these terms mean. Bronchopneumonia means that the pneumonia started and has bronchial involvement. But the alveoli are what's really affected. And what does parenchymal mean? Huh?
Alveoli.
It means alveoli in the lungs. In the kidneys, the nephrons are the parenchyma. So with diffuse alveolar inflammation and consolidation in one area, that's a lobar pneumonia. How many lobes are in the right lung? How many lobes are in the left lung? Okay. And diffuse infiltrates specifically caused by mycoplasma pneumonia are typically termed interstitial pneumonia. And I don't know if y'all remember from biology, or if you took microbiology, a mycoplasma is smaller than a bacteria, but it's not as small as a virus, and it's still in the bacteria category. And the mycoplasma pneumoniae typically is a mild pneumonia, and people, even though they have some mild signs and symptoms, they're able to still function and not be hospitalized. So it has been given the term walking pneumonia. And this is just a mycoplasma underneath the microscope. Yes.
How contagious can pneumonia be?
It depends on what